Yeah, numbers are unfortunately very small, but I think that raises the point. And I mean, we still don't know 100% what we should do in eccentric calcifications. However, is definitely true that you some response with lithotripsy in those lesions, and of course the answer, the definitive answer, can only come from randomized trials, but it's quite reassuring that both in this limited registry and in much larger data that were analyzed from the disrupt registry by Holger and presented before, you definitely have a good outcome and a good lumen and stent expansion in both cases without complications.
Carlo, maybe I missed it. So did you also count the number of pulses which were applied to the extended in comparison to the concentric lesions?
I didn't show it because of time, but I always go really to the maximum. So more than the time, you should say how many balloons I used. And if I remember well, it's an average of 1.4. It was slightly less than in the trial, in the registry.
So it'll be interesting, Carlo, with more numbers to really dissect into all eccentric versus eccentric nodular, eccentric non-nodular, wouldn't it? To see, because I think nodular calcium, even the atherectomy techniques, you never get a perfect result. You always still get some eccentricity and asymmetry. In my experience, certainly, even with debulking, I suppose, the lesion with atherectomy. So I think it would be interesting if we had a larger number of these lesions to assess, to see, you know, how it performs in non-nodular versus nodular eccentricity.
Fortunately, nodular lesions are really rare, so really we should put together a large group to achieve a sufficiently large number of cases. I agree with you. My results are far to be perfect when you truly protruding nodules. We even went in one case out of desperation to a compassionate use of orbital atherectomy. That I think was the very first in Europe, and went reasonably well. But again, there was some level of asymmetric final expansion.
It was some fantastic data from both you, Carlo, and Holger. Really interested to see that, and thanks very much for sharing it with us.
Yeah, it's my pleasure.
Okay, so thanks to Carlo and Holger and Shockwave for setting up this webinar today. I suppose to wrap things up, we would conclude from the case that we've shown you and from the data that's been presented that there is a role for our IVL both in concentric and eccentric calcium, and certainly from the data that we have and the clinical experience of a larger group of high volume users around Europe, the feeling is that it is effective and safe in that type of calcium morphology. So thanks again, and we hope you enjoy the webinar.
Thank you, Margaret. Thanks, Carlo. Goodbye.